Hi, it's Dr. Zen. I wanted to share with you some of the most common misconceptions that I see for abdominoplasty or a tummy tuck. I've been doing tummy tucks for 25 years and I've perfected my technique, but there's three common misconceptions that I always hear about, and I just want to go ahead and talk about them and debunk them. Number one, that tummy tuck surgery is going to be a weight loss surgery for me. Tummy tuck surgery is not a weight loss surgery. Tummy tuck in the best patients are patients who have lost weight to a point where they are happy at their current weight and are planning on having this weight for the foreseeable future. So they're at a stable weight. They haven't done any crash diets, their nutrition is good. The components of a tummy tuck that would reduce your weight would be the amount of liposuction that's performed, and that's generally for final contouring of the abdomen, and the amount of actual skin removed. And people will grab onto their skin and say, there's got to be at least 20 pounds of skin here. And I can tell you it's not. It's going to be maybe 2 pounds. It's not a lot of weight. So the idea is not to see a big change in the scale, but to see a beautiful change in your shape to a point where you feel great in your clothes and you just don't look like you have all that extra tissue around your belly. Number two, drainless tummy tuck. The misconception here is that if you're doing a tummy tuck, you do not need to have a drain. That if you're putting a drain in, somehow you're not a modern surgeon or you somehow don't know the most up-to-date techniques. Nothing could be further from the truth. I think that when you think about, do I want a drainless tummy tuck, what you should be thinking about is the trade-off. And the trade-off not having a drain versus having a drain is, do I want to have prolonged swelling in that area and possibly fluid collection that may require a drain later? The tummy tuck surgery creates a very large space. Our bodies naturally exude fluid into the area with proteins and cells that are going to help us to heal. That fluid itself is either going to be removed with a drain or it's going to get absorbed in those tissues of the belly, especially at the bottom where your incision is. Now, do you need to have a drain? No. You can definitely, those tissues can swell and the body can slowly get rid of that tissue, that fluid over time, but then you're going to have swelling for a while. So it's a trade-off. Now, tummy tuck techniques that use drains versus no drains, the techniques are almost identical. And I know in my hands they are, because the big point about not having a big space to collect fluid is that we're doing special quilting sutures to actually suture the abdomen down everywhere so there is no space. That's all well and good when you think about it conceptually, but the truth is you've still created a very large wound and the body is trying to heal that wound. So the fluid will still be there. It's just a function of, is it going to be held in one place or is it going to be able to move around as a big fluid pocket? And so stitches definitely help, which is why I've incorporated them for many years. These quilting techniques have been brought out for a while. We've tried to do drainless tummy tucks in the past with tissue glues, special suturing, and I've still come back to the point where patients will have a better result and a faster recovery having a drain in for a week. It also allows them to monitor their motion and make sure that they're not doing too much or that they're having any bleeding problems that I need to know about. If a patient doesn't have a drain in and is moving around and doing things and getting back to normal too quickly and gets a pocket of fluid there is a treatment for that. It's called a drain. Misconception number three is that every tummy tuck needs muscle tightening. Well, what is muscle tightening? So when you look at your tummy and you think you have a big round belly and you want a nice flat belly, the real question is why? Why is it rounded and not flat? If it's because your muscles are loose and they're not very strong, or with pregnancies or weight gain, now those muscles have separated. The medical term for that is a diastasis recti. There's literally a space, and so you just get a bulge, especially when you're being active or straining on your abdomen. That is like an absolute indication during a tummy tuck to tighten up those muscles. The problem is if that's not the cause of the extra tissue, if it's that you have extra fat tissue only and you have some hanging skin, you can get a beautiful tummy tuck result by just getting rid of the extra fat, by doing liposuction, getting rid of the extra skin, and giving the same exact scars that you would have as if you tighten the muscles, except the muscles are fine. And a lot of my patients, especially when they've been working out hard and doing a lot of core work, they have amazing muscles. And you can tell that on yourself by just simply lying down, doing a leg lift. So lift both of your legs up about 6 inches and just feel your belly, especially in the lower part of your belly. when you tighten your muscles, if it flattens tight, you don't need your muscles tightened. If you feel a bulge, you feel like when you lift your legs up, you feel something bulging, then that's the reason to have muscles tightening. And why does it matter? Because it dictates the recovery after the surgery. Because if you don't have your muscles tightened, number one, it's not painful. And number two, within a few weeks, you can be back doing your regular activities in a nice compressive garment. If you have your muscles tightened, you're pulling muscles together and really relying on that stitching to hold those muscles together. It's as if you fixed a hernia. And the restrictions for that are no heavy lifting for 6 to 8 weeks. So it's going to limit what you do. When people say that their tummy tucks were painful and they had a lot of pain or they needed a lot of pain medicine, number one, they had muscle tightening. And number two, nothing was done to try to help prevent that. And when I was at Duke, probably even 10 years ago, we started enhanced recovery programs for abdominal surgeries by doing blocks. They're called TAP blocks. And I've been doing those ever since. And that is a game changer. You will literally feel no pain in that area, almost as if you didn't have your muscles tightened. And so, I think you'll hear a lot about people, we're going to give you an injection, we're going to do all these things to make everything numb. Again, nothing new here. So the key is, do you need your muscles tightened? I think too many people just tighten everybody's muscles, and it just prolongs recovery and potentially makes it more painful as well. So the key is individualize. I will be able to tell you when I examine you in the office whether you're going to need muscle tightening or not, where your scars are going to be, how much liposuction we're going to do, and any other questions you may have.